Good morning. You're listening to the OHSU Effect Inside Health and Science on FM News 101. 1 week until Santa Claus climbs down our chimneys and leaves our kids presents and smiles and tons of memories. But what if your child is in the hospital? Can they still enjoy Christmas? How can parents ensure that they're enjoying themselves at all? Sandra Westfall is the manager of the Child Life Program at OHSU Doernbecher Children's Hospital. She and her team of specially trained child life specialists ease the stress children and their families experience while in the hospital. They provide activities that support a child's individual development and ability to cope with their hospital experience through play, education, and expressive activities. Sandra, good morning.
Good morning to you.
So what is child life therapy exactly?
Child life therapy is a profession that works directly with the pediatric patients and their families, addressing their emotional and developmental needs while they're in the hospital setting.
What kind of training do you need to be a child life specialist?
We have at least a 4-year degree that's required, and I'd say all of us, except maybe exception of one, have a master's degree at Doernbecher Children's Hospital.
So describe how the program works exactly. What exactly are you doing for these kids?
Oh, that's a great question. We have our responsibilities are divided into services. In other words, we have a child life specialist who works with the children who are getting treatments for cancer. We have 2 child life specialists who work with children who are coming in for surgeries or just medical procedures. And we have someone who's assigned to the ICU to take care of those trauma events. And we have our intermediate care unit, and somebody's watching that. We have care of the Family Resource Center, which is informational for families and needing to get information and understanding of what their child's disease may be. So all of us are involved with children directly. That is our focus. We are not doctors or nurses. We are trained to work with the child, and our background is child development.
How often do you guys interact with children and their families?
Every day. People ask us, "How do you see all the children?" No, we're not able to see every single child. I would say that we would average amongst ourselves in our areas to see at least 5 children a day, because sometimes we are spending up to 45 minutes to an hour with a child, preparing them for surgeries, preparing them for a procedure, teaching them coping skills to help them get through those procedures.
Yeah, I mean, surgery is scary for anybody, but especially for a child. I mean, what is something that you do to calm them down, to prepare them?
Let's give an example. We have a wonderful heart program. One of the things that the child life specialists do is work with children through medical play. We might bring out our real medical equipment, simple things like starting an IV or a stethoscope, and we prepare kids for what they're going to be seeing around them and what kind of tools that they might have to nurses might use. So we prepare them through play. They get to be in charge of the equipment, and they will give the doll or a puppet an IV. And then we will also give them a tour of the areas where they will be coming to be admitted, where they will be starting to go into surgery with their parents. And then we will also give a tour of the parents and the child to the ICU and on up into the other areas where they will graduate from the ICU after their heart surgery. That's a fairly typical preparation for a heart patient, but we do that on a simple basis with children who are just getting an IV or maybe need some other procedures done in the procedure room and just need a way to cope.
Well, it's kind of nice because it sounds like there will be no surprises for when the real thing happens. You're showing them what's going to happen.
That's the goal, so that they can familiarize themselves with everything that's going to take place to lower their anxiety.
How do the children typically respond to this?
Well, when it comes to play is the language of children. So medical play, and those of us who are working to help them through play, they respond to us quite nicely, especially if we have play equipment that we're going to give to them and let them keep, or if we also give them a prize just for showing up and talking with us and letting us help them. So play and toys speak the language of children.
Are there any activities for siblings who are often, spending a lot of time in the hospital as well?
Yes. We often think of siblings of kind of being out there in the margin, and they need to be in the information loop. So if we're training and working and preparing the patient, I often like to have the sibling right there with us so they're getting the same information and hearing what is being said, so to clear up any mysteries. But also in the hospital, we have several playrooms and open invitation for children to come into the playroom at any time, including the siblings, so that they can do art, they can do medical play themselves, and have movies and participate in any of the activities that we have planned.
Well, being in the hospital is stressful, of course, any time of the year, but having a child in the hospital during the holidays must be especially difficult. How do you and the Child Life team help families participate and enjoy the holidays while in the hospital?
December is our busiest time of the year. We have several kinds of events coming to the hospital. We have musical events. We have special visitors who are coming to bring maybe a party or an activity for the kids that we can help guide and prepare with them. But we also have lots of donations from around the community of toys and things like this that we can pass on to the children and help prepare them for that. But the whole month of December is full of activities that are Christmas related, and one of them we just had recently was the Make-A-Wish party, where our Make-A-Wish Foundation came in to give a shopping party to the children who can't go shopping for their parents. So they bring a lot of items to the hospital, and we take the patients up there to shop, and Make-A-Wish volunteers wrap the presents with the tags on the names of the family on the presents, and the child takes it back to their room.
That is so fun, and it must give them a sense of normalcy as well.
That's one of the goals of Child Life, is to bring normalcy and mastery to the hospital setting.
So is Santa Claus going to come to Doernbecher?
Santa comes. He knows where every child is, and he does know where Doernbecher children are, and he will be there on Christmas morning, and we get to meet him and help him take all the presents that we have ready for the children. Every single one who are going to be in the hospital, Santa will deliver to their rooms.
That's great. And I'm sure that there's some children who maybe can't leave their rooms or who are not as mobile as the other kids. But it sounds like you accommodate everybody and get everybody involved.
Everybody is involved. In fact, a lot of our patients who have been in the hospital on Christmas, who are chronically ill, always say, "We like being here at Christmas."
That's great.
Yeah.
Do you do anything special for New Year's Eve?
Well, the week before New Year's Eve, or the Wednesday before, we play bingo every Wednesday live. The kids everywhere in the hospital can play, and we load up the bingo cart with games, with the interest and goal in mind that they will have lots of games to play with their families for New Year's Eve. But other than that, we kind of lay low, because even with that, there's a lot of family visiting, and you want to give them their privacy.
Well, how can the community help families at OHSU Doernbecher during the holidays and really throughout the year?
I would say it's throughout the year. We have a very generous community throughout the state, throughout the community, throughout Southwest Washington, who recognize our hospital, and they bring gifts and donations. And so we receive those for the children and make sure that they are passed on to the children. But what's even more important is to think about maybe something in July where we could use some more crayons or some more coloring books. And those are the kinds of things that everybody in the community has been generous with us. But they help throughout the year. But those are the kinds of things. They are welcome to call the Child Life Department and say, how can we help? And we'll figure some things out with them and give some information.
Well, what is that phone number if people are interested?
That number is 503-418-5388.
You can also call 503-494-8311. That's the main switchboard at OHSU, and they can help you with anything. And, of course, this information will be on the OHSU Effect website. Just go to kxl.com and look for the OHSU Effect page. Sandra Westfall, the manager of the Child Life Program at OHSU Doernbecher Children's Hospital, thank you so much.
Thank you. It's a pleasure.
And don't forget, we have the OHSU Effect as podcasts on our website. And if there is a health topic you'd like us to cover on the show, send me an email, lacey.evans@kxl.com, or you can follow me on Twitter @LaceyEvans and send me your suggestions. Also, we are having a contest here at the OHSU Effect just in time for Christmas. We're giving away tickets to Body Worlds and The Brain, an all-new exhibit at OMSI running now through early March. Just go to kxl.com and click on the banner where you can enter to win. More of the OHSU Effect Inside Health and Science coming up in just 5 minutes on FM News 101.